Is your heart older than you? Find out with this free test. Today I am going to show you a way that you can find out if your heart is older than your actual age. This test is very simple. It takes about 2 minutes to do. And this is something that we actually did at a recent senior living event that we went to. Now, it's not only seniors that need to check their heart health, but more importantly, it's those seniors that have risk factors or family history of cardiovascular disease or heart attacks. If you are concerned about your heart health, then this video is for you. Stick around because at the end of this video I'll reveal a way that you can get this test done totally free of charge. This could save your life, so stick around until the end. Welcome back everyone. Welcome back everyone. If you are new here, we talk about health, fitness, and wellness from a faith-based perspective. So if that's something you're interested in, please consider subscribing so that you get notified every time we post new videos. Before we dive into today's topic, let me quickly share with you a success story of one of our viewers. She's in her late 60s and she started walking regularly after watching our videos. Within 3 months she lost over 30 pounds, had more energy and now walks 3 miles a day. If you would like to read more stories like this, check out the link below. Today we are talking about a way that you can find out if your heart is older than you are. How does that even make sense? Well, you can actually be biologically older when it comes to your heart. What do I mean by that? Let me explain. Let's say you are 65 years old, but if you have the heart of a 75-year-old, that means that your heart is actually older than the rest of your body. Your heart might be in worse shape than someone who is 75. So how do you know if your heart is in good shape? Well, there are several things that you can do to find out if your heart is in good shape, and one of them is looking at your blood pressure. Another thing you can do is look at your pulse rate, also known as your heart rate. There are other ways to find out if your heart is in good shape. The simplest way is to check your blood pressure and your pulse rate. So what is considered a good blood pressure for someone in their 60s? Well, according to the American Heart Association, a normal blood pressure for an adult is less than 120/80 millimeters of mercury. Anything higher than that is considered high blood pressure. So if your blood pressure is 140/90, that means that you have hypertension or high blood pressure. High blood pressure is also known as the silent killer because most people don't know they have it and it can lead to heart attack, stroke, and kidney disease. The bottom line, if you have high blood pressure, you might have the heart of someone who is older than you are. Now let's take a look at your pulse rate. What is considered a normal pulse rate? Well, there are different formulas out there, but the easiest way to calculate your maximum heart rate is 220 minus your age. So if you are 60 years old, then your maximum heart rate should be 220 minus 60, which equals 160 beats per minute. So if you are 60 years old and you have a pulse rate that is consistently over 100 beats per minute, that might be a sign that your heart is not in great shape and it might be older than it should be for your age. If you are exercising, your pulse rate should go up. But when you are resting, your pulse rate should be lower. If you have a resting pulse rate over 100 beats per minute, that is definitely something you need to discuss with your doctor. The bottom line is that if your blood pressure is too high or your resting pulse rate is too high, that might be a sign that your heart is older than it should be for your age. You may be wondering, why should I care if my heart is older than I am? Well, having the heart of someone older than you are puts you at risk for many chronic conditions, including heart attack, stroke, and kidney disease. It also reduces your quality of life and it shortens your lifespan. In fact, studies have found that people who have the heart of someone older than them are 2 to 4 times more likely to have a heart attack or a stroke. So if you want to live longer and reduce your risk of chronic disease, you need to keep your heart healthy. I'm gonna reveal some tips that will help you do that. But first, let me tell you about an event that we're having soon. We are having a virtual health and wellness event. We are bringing together some of the leading experts in the country to talk about different ways that you can improve your health and your quality of life. We're going to have doctors, nutritionists, fitness experts, and more. This event is totally free and you can attend from the comfort of your own home. You will learn practical tips that you can use immediately to improve your health and your quality of life. And this is something for everyone, not just seniors. So whether you're in your 30s, 40 seconds, 50 seconds, or 60 seconds or older, this event is for you. We are going to have something for everyone. So please go to the website below and register today. Space is limited, so you don't want to wait. Register today. Alright, let's dive right in. One of the best ways to keep your heart healthy is to eat a healthy diet. A healthy diet is one that is rich in fruits, vegetables, whole grains, and lean protein. It is also one that is low in saturated and trans fats, cholesterol, and added sugars. A diet that meets these criteria is the Mediterranean diet. In fact, studies have found that people who eat a Mediterranean diet have a lower risk of heart disease, stroke, and dementia. So if you want to keep your heart healthy, start by eating a Mediterranean diet. Another way to keep your heart healthy is to exercise regularly. Exercise helps to strengthen your heart muscle and improve your overall health. Aim for at least 150 minutes of moderate intensity exercise per week. And if you're not sure where to start, check out our channel. We have tons of videos with low-impact exercises that are perfect for seniors. Another way to keep your heart healthy is to maintain a healthy weight. Being overweight or obese puts extra strain on your heart, and it increases your risk of developing high blood pressure and diabetes. To maintain a healthy weight, you need to eat a healthy diet and exercise regularly. Finally, don't smoke and avoid secondhand smoke. Smoking damages your blood vessels and it makes your heart work harder. If you currently smoke, please consider quitting. There are resources available to help you quit. Bottom line, if you want to keep your heart healthy, eat a healthy diet, exercise regularly, maintain a healthy weight, and don't smoke. But what do you do if you've already had a heart attack or if you have risk factors for heart disease? Well, in addition to the things I just mentioned, you also need to see your doctor regularly and follow their recommendations. For example, your doctor might recommend that you take medication to lower your blood pressure or cholesterol. They might also recommend that you get a cardiac rehabilitation program. A cardiac rehab program is a supervised exercise program designed to help you recover from a heart attack. Bottom line, if you've had a heart attack or if you have risk factors for heart disease, don't take any chances. See your doctor regularly and follow their recommendations. So I promised you that I would tell you a way that you can get this done for free. As I mentioned earlier, this is something we did at a senior living event we went to recently. At the event, we set up a booth where we took people's blood pressure and pulse rate. We also gave them information about heart disease and stroke prevention. The best part, this service was totally free. There are many ways that you can get your blood pressure and pulse rate checked for free. Your local health department might offer this service, or you can contact your local American Heart Association chapter. The bottom line, there is no excuse to not check your blood pressure and pulse rate, so please do it today. You could be saving your life. Well, I hope you found this information helpful. Please remember to like, share, and subscribe. And until next time, I wish you all the best in your journey to better health.